if you have hormones that are not in balance, you can have a problem where you'll have fatigue, where you'll have dry skin, where you'll have your hair falling out, or you'll have your mood may be disordered. So you can have depression even from that. So the three topics I want to cover today are metabolic hormones, sex hormones, and stress hormones. And then once we do that, we'll open the floor up for questions. And if there's any questions you have during the presentation, please feel free to stop me, because that makes it more interesting that way for us to hear from you too. So first of all, I wanted to talk about is metabolic hormones. So metabolic hormones, the major metabolic hormone in your body is your thyroid hormones. So your thyroid is a gland that's shaped like a butterfly, they say, or a shield. It's right above your right in front of your trachea. For those of us who have normal functioning thyroids, we never even think about it. Your thyroid hormone is regulated from your hypothalamus, which sends signals to your thyroid gland to make thyroid hormone. And when it's regulated normally, you go about your daily life and there's no problems. The problems occur when you get an infection in your thyroid, or for whatever other reason your thyroid stops functioning. That's when you have hypothyroidism. Hypothyroidism is very common. Fortunately, it's very treatable. However, there are sometimes when people have thyroid problems that are treated in a laboratory, findings are normal range, but they still feel poorly. So then we say, well, what is the other causes of, why do you not feel well? And it could be something else besides your thyroid. So maybe your thyroid plus a vitamin deficiency, maybe a thyroid plus another hormone deficiency. So sometimes you can go along, and one of your hormones is a little off and you're okay, but then when you start compounding it by adding other things that are not at the optimal levels, then suddenly you have problems where you have a symptom. So the number one symptom of low thyroid is fatigue. Another one is weight gain. Another one is mental lethargy, meaning that you're foggy, your brain isn't working. Another thing that you can have with low thyroid is constipation, hair loss, and also dry skin. So all of those things are things that hopefully once you get treated in a certain level, everything is okay. However, sometimes...
Symptoms as you go along.
Yeah. And sometimes when we treat it, the laboratory says it's okay. But it's not okay because the patient doesn't feel okay. And so that's an important thing to note, is when you go to the doctor, if your thyroid levels are normal, but you don't feel normal, then you need to have a further conversation, because there's other things you can check. There's more other labs you can get a little bit more in depth. And you can even change your medication. So typical replacement is with T4, which is Synthroid. But there's also ways to get compounded medications. And there's also ways to get medications that mix both inactive, which is the T4, and active hormone, which is T3. And your thyroid will convert it, but sometimes people's thyroids aren't working as well, so you give them a mixture of both of those. So that's metabolic hormone. That's the major metabolic hormone that most people think about. Sex hormones. Sex hormones is a popular topic. Why is that? Because sex hormones can cause you to feel the same things. You can have problems with fatigue. You can have problems with depression or otherwise mental issues having to do with it, whether it be confusion or forgetfulness. The other thing that sex hormones obviously can include problems with sex. So patients who have low libido, let's say, may have a problem with testosterone. And that can be in men and women. So one of the things that we check for in our patients, if they're complaining of these things, is we'd like to do hormonal panels to see where their hormones are. And if they come back all normal, then great. Then we know that at least that's normal. But a lot of times doctors are reluctant to check that, because it opens up a whole can of worms that maybe they don't want to deal with it, or maybe they'll send you to the endocrinologist. And treating sex hormones or treating hormones is a somewhat controversial topic, because if you do check hormone levels and then you treat somebody, you have to have close follow-up with them. Because hormones, if you're given hormones exogenously, meaning not produced by your body, you can develop problems. You can develop problems with vascular disease. You can develop problems with side effects from the hormones themselves. So it's important to have close follow-up, and a lot of times doctors are reluctant to do that because maybe they don't feel like the patient's going to follow up, or they don't have that close a relationship. So sex hormones, estrogen and progesterone are for women. Those are the ones that we treat with women. And then there's also testosterone, which we can give to women as well, that helps with low libido. It can also help with fatigue. It can help with depression even. So those are some of the things that we do for women, is check their basic hormone levels and make sure they're in order, and if they're not, then address them as needed. For men, we typically will check testosterone. There are other hormones that can be involved with testosterone, like estrogen in women, that can cause their testosterone levels to actually drop. So if a man is overweight, for instance, he can have higher estrogen levels than normal because testosterone is converted to estrogen in the fat tissues of your body, the adipose tissues. And if you do that, you can get problems that are related to that. One of the things that we don't talk about much but are very important is stress hormones. So what are stress hormones? Cortisol is a stress hormone. Norepinephrine is a stress hormone. Epinephrine is a stress hormone. These are the hormones that your body produces in response to a threat. So if you're going about your daily life, here in the modern society, we're not getting chased oftentimes by wild animals or having, catastrophes that happen historically that did happen and caused you to have stress. But there's everyday stressors. So there's stressors of your job. There's stressors of your family. There's stressors of any number of things. Your friends driving you crazy. So one of the things that we have to keep in mind is, how do you balance your life so that the stress that you suffer on a daily basis doesn't impact you? And one of the best ways to balance your stress hormones is sleep. Sleep is very important. 8 hours of sleep is what they say is optimal. Not many of us get that, but if you can, then that's great. But it's important to have sleep. It's important to have a time from your body to basically discharge all of these signals that it's been getting over the day. Another important thing to do to balance your stress hormones is exercise. Exercise, if you do exercise vigorously or moderately for 20 to 30 minutes a day, if you do that 4 or 5 times a week, you'll do yourself a huge favor as far as helping to normally balance your hormones, meaning allow your cortisol levels to drop back to normal and allow you to not have the deleterious effects of a stress hormone. So if you're going around all day long stressed out, your body feels that. It's okay to have stress hormones when you need them. It's okay to have stress hormones, epinephrine levels be high when you need to outrun a bear or climb a tree or whatever. However, if you're going around your whole day at work because your boss is whoever he is or she is, or your work environment is just so stressful, that's going to eat at you over time, and it can cause problems with your heart. It can cause you to have high blood pressure. It can cause you to have premature aging. It can cause you to have possibly even a stroke. So those are the things that you have to be careful of. Is you can't measure those, or we don't measure those, but those exist. Those are hormonal balances that exist. We know they exist, and you have to do your best to balance those out. So back to the part about balancing hormones. How do you do that? Well, you can balance hormones, like I said, through medications. So different types of medicines we use for balancing hormones. Thyroid hormone, we typically give oral medication for that. Works very well. Usually, if it doesn't work very well, then you can look at different modalities of using different combinations of oral medications. Balancing sex hormones is also, you can do it by oral medication, but we can also do it increasingly through topical medication. So we use creams, and we can use patches. We can use compounded medications. We can use injections even. So those are ways that you can balance hormones that are the sex hormones like testosterone, estrogen, and progesterone. And like I said, women and men both can have testosterone deficiencies and have those corrected. The third way, as we talked about, and is important for all of the hormones, is sleep. And like I said, because the way hormones exist in your body, they're not off in one space. The thyroid's doing its thing, and the testosterone's doing its thing. If you have low thyroid, you can have low testosterone because of the interaction between the hormones as they are interacting in your body. The other thing that hormones can do is cause you to have medical problems. So low testosterone, for instance, is a risk factor for developing cholesterol. So that's a general overview of what are some of the common things that we see in practicing medicine and some of the hormonal imbalances you can have. And right now I'd like to open the floor if you're interested in asking your question, and so that we can have a dialogue about that. Anybody have a question? Yes, ma'am.
Yeah, if you, what is the alternative if you can't have the estrogen due to cancer in hereditary?
If you can't have,
yeah.
So what is your alternative to using for estrogen if you've had cancer before? So if you've had a cancer that's responsive to estrogen, such as a breast cancer or endometrial cancer, then yes, it is contraindicated to have estrogen. Right. At that point, you wouldn't replace the estrogen. What you would do is try to do what we call natural remedies.
Right.
So natural remedies would be trying to balance out whatever the effects of the estrogen depletion are with a remedy. So one of the things you can have when you have low estrogen is bone loss. So how do you get around that? Well, certainly weight-bearing activities is good for bone loss. Also medications that treat bone loss. As far as your symptoms, whether you're having a mental, if you're having forgetfulness or things like that, then there's specific herb supplements that actually work that you can take for your memory. The important thing is that,
The ginkgo biloba?
excuse me?
Ginkgo.
Yeah, that's a very popular one. The most of the herbal remedies that you hear about do work. Do they all work effectively across the board? No, because there's such a thing as herbal remedy that's not high quality and one that is high quality. So certainly there's that. But I think most of these herbal remedies do work at some level. Otherwise, they wouldn't be in existence. You know, they would have come out one day and then no one would have bought it. So ginkgo is one that works. There's a whole host of them. And what I always tell people or patients is, it never hurts to try so long as, within reason. And then you just give it a trial. If it works, it works. If it doesn't, it doesn't. It's proof's in the pudding. And it may work for you, but not for you.
It doesn't harm you though, because it's natural, right?
Well, it's hard to say it doesn't harm you. If you go to a reputable source, generally speaking, yes, it wouldn't harm you. But certainly always ask your physician before you start any type of treatment, even if it's over the counter, especially in the context of having had something medically. Yes, ma'am.
Okay. Thank you.
Any other questions? Yes, ma'am.
The thyroid business, is that specific blood work that the doctor has to have you go and I mean, if you just had blood work done,
Yeah.
is it specific?
It depends. I just was reading an article on the way over here, or actually before I came here, reading about thyroid in preparation for this. Thyroid hormone, if you look into the national guidelines, they don't even recommend you check it unless the patient's age 60 and they have some symptom.
60.
Yeah. And they have some symptom. So
you're saying
back to, go ahead.
Symptoms are,
So symptoms of low thyroid would be fatigue, weight gain, hair loss, constipation, dry skin.
well, what couldn't that also be at when women go through menopause? Like I'm at that age. I'm
Sure.
in my early 60s. So I'm feeling tired, hot, so could that be also a symptom of menopause versus thyroid?
Well, menopause typically is the perimenopausal period is plus or minus 2.5 years around the time of actual menopause. After that, your symptoms of menopause, whether it be hot flashes, forgetfulness, or any of the menopausal symptoms should kind of dissipate. After you're through menopause, certainly you could have lingering effects of low hormones. But back to your point about what tests to do for thyroid, there's a multitude of tests to do. The first test to do is a screening thyroid exam, or screening TSH. Not all doctors do that though, because like I said, national guidelines don't say that you should do any testing necessarily. I test in most every patient at least once every few years, depending on their age.
So are you considered like a general family doctor?
I am a family physician and a sports medicine physician, yep.
Okay.
Sports medicine is basically what I do is non-operative orthopedics, and then also things that have to do with the athlete, whether it be concussion, cardiology, and things of that nature. But for a person who has fatigue, certainly you should always have certain vitamin levels checked. So vitamin D, vitamin B, those should be checked always.
I take a lot of vitamins, so
Yeah.
I don't think it's that. I
Yeah.
just think that
When was the last time you had levels checked?
I've never had my thyroid checked.
Yeah.
Never. That I know of.
I will tell you about the part about vitamins. I have patients who come in on consults and they say, very commonly, I have low vitamin D. Terrific. What are you taking for it? Oh, I take vitamin D every day. How much? 2,000 micrograms. Great. Okay, what was your last vitamin D? It's still low. What did your doctor say? Well, they asked me if I was taking vitamin D supplement, and I said yes. And then what did they say? They said, just keep taking it. So that's obviously the wrong answer. Obviously the right answer is either double your dose or get rid of that supplement because it's not working.
Right.
So the fact that you're taking vitamins is good if you need them. It is good to have also some baseline levels checked if you're still having symptoms.
With my thyroid, though, it was never hot. It was always cold. So,
Well,
God, I used to
there's
freeze.
two kinds of, isn't there overactive and underactive?
Hyperactive thyroid, you'd be hot. Hypoactive or hypothyroid, you would be low, cold.
And as far as hormones, I've been on hormone replacement for years and years and years. I don't have cancer in my family, so I can take it. And if I ever decide that I want to go off of it, I'm wondering, am I going to just fall apart?
Well, the best thing to do would be to wean yourself off of it.
It's like if it's essential needed.
The best thing to do would be, if you're interested in, is talking with your doctor about weaning off of it.
I mean, I take like a 0.5 milligram. It's very, very
Yeah.
low dose.
Yeah. The best thing to do, if you're interested in getting off of it, is talk with your doctor and wean off of it. I would never stop it cold turkey.
And when you say wean off of it, there's natural ways to wean off of it.
Well, you just you decrease the dose, and then if you start having symptoms, you could take some supplement. Maybe you won't even have any symptoms.
Well, you said something about bones,
Mm-hmm.
because I have osteopenia. So that's what I'm worried about, is the bone part.
So if you have osteopenia, then certainly you should be doing weight-bearing exercises if you're not already. The other thing you should do is make sure your vitamin D level's good and make sure you're taking enough calcium. There's also specific bone supplements you could take that have hydroxyapatite in them, which is the cement basically that makes bones stick together. So there's ways to get around it. But you should also consider, make sure that your calcium that you are taking through, if it's through supplements, is absorbed, because a lot of calciums that are through supplements you can't absorb at all. So you have to have it through your diet as well.
I assume you take new patients?
Pardon?
I assume you take new patients?
Yes, ma'am.
Where's your office?
Our office is in Wesley Chapel off State Road 56 near the Synovus Bank.
Yeah,
yeah.
near the mini dealership.
Yes, ma'am. Yes, ma'am?
What is hormone replacement therapy?
Hormone replacement therapy means that you're going to give, typically a female, hormones that their body would normally take or make. If they're not making them, you give them to them. So you give them to them in the form of pills, you give them to them in the form of creams, or you give them, in the case of men, through injections. Hormone replacement therapy is meant to take the place of the hormones your body produced if you're not feeling well. Now, if you go through menopause and you get through the adjustment period of that perimenopausal period, and you don't need to be on hormones, and you shouldn't be. So hormone replacement therapy is for women, particularly, who are having symptoms that are causing them to have distress in their life to the point of where the risk of the hormone replacement therapy is less than the risk of the treatment is less than the benefit.
So it's saying like severe hot flashes.
Yeah. Or some women have
Yeah.
very pronounced weight gain that they just have no explanation for, or they have sexual problems, such as there's some things that your body does with the hormones that, and then you don't have to give necessarily hormones through the whole body then. So you can be selective about where you use hormones and for what you can use topically, for instance, for sexual dysfunction.
How would you know if you're balanced?
Yes, ma'am.
Your hormones are imbalanced if you're on something like a low dose. How would you
Well,
know?
you would not know.
Yeah.
Because you're dosing it. You are not, by definition, when you give someone hormone replacement therapy, you are balancing their hormones.
Okay.
Now, could you have something that's not hormonal? Yes. Could you have anemia? Yes. Could you have vitamin deficiency? Yes. Could you have a number of other things? Yes.
But in other words, you would have to go off hormone replacement in order to be able to find out if you're balanced.
If you went off of hormones and you were menopausal, your hormone levels would drop. The question then there is, do you have symptoms? Because every menopausal woman has low hormones. That's the definition. The question is do you have symptoms that necessitate you taking a medication?
Are you primarily just losing the estrogen? Because there's other hormones that we produce other than just estrogen.
For menopause, yes.
Yeah.
Estrogen and progesterone through the dysfunction or through the atrophy of your ovaries. Yes, the progesterone and estrogen are produced in the ovaries, and once those go down, you still have some production through your adrenal glands, but it's very minuscule.
What I'm taking has a combination of both.
So, you mentioned the taking a herbal thing for the estrogen. So, if you're on serotonin replacement therapy, you can't take some of the.
Some of those, yes, some of the supplements could possibly cause you to have elevated serotonin levels.
Is serotonin that's for sleeping?
That's melatonin.
That's melatonin.
Oh, okay.
Serotonin is like your happy,
Yeah, if you have
happy hormone.
if you're on an SSRI, there are certain supplements that you should not take because they can raise your serotonin levels and give you serotonin syndrome. I usually
you can't take the estrogen, but you can't take the herbal either.
I usually say, let's try it. If I have a close relationship with a patient, I'll research whatever the thing is and say, look, I've read about this. They said there is a small chance that you will have a minor side effect. Do you feel like you want to try it?
Okay.
And if they're not
So
risk
the side
averse,
effects are not huge.
it depends. Like I said, if you read it and it says, taking this supplement with this medication will stop your heart, then we'll say
Of
no.
course.
But if it says it may cause fatigue or headache, well, then we'll just try it and see if it does. If it does, it does. If it doesn't, it
They have
doesn't.
to list that it might not happen with everybody, but that's
Yeah.
what's happening.
Yeah, there's a lot of side effects that may or may not be clinically significant.
I know my kids are always, when we first came to this country, because we were from, they don't have to give the side effects. My kids look at them and go, how does anybody take anything in this country? Because you got 2 minutes of the ad and then
Yeah.
4 minutes of the side effects.
Baby.
Exactly. How does anybody take anything yet?
Anybody else have a question?
I need to get a business card from you.
Okay.
Is that nice?
I think they're in your bag. If not, we'll get them.
Okay, thanks.
I'm making an appearance again.
We're in trouble.
Well, thank you. Talk about
Thank
Thyroid.
you.
Thank you.